Hello, good afternoon. Dr. Trudy Ofondo of Snowspirations Global Health Solutions. Thank you and welcome to our weekend clinic, Open Clinic with Dr. Trudy. This afternoon, we're going to talk about prenatal vitamins. Prenatal vitamins. When, why, and the health benefits of prenatal vitamins. So please quickly join. I'm going to give my presentation. When I'm done, I'm going to open the clinic and you have opportunity to ask your questions. You see, pregnancy is a very well-planned process. To have a successful pregnancy, which means to have the woman in good health and to have a very healthy baby, you have to plan ahead on time. To be a good mother, to have a baby that will thrive, your pregnancy journey actually begins the moment you are an adult for the woman, also for the man. Now, part of planning in pregnancy, it's making sure you're in a good place. It's making sure you have adequate components that will help you to create a healthy baby. Your prenatal multivitamins is actually one of the preparations. So it's called pre. Pre means before. Natal is the whole process of that pregnancy. So for every intending mother, I'm going to throw a couple of numbers out there. Assuming you want to be a mother in 2023, you should have started taking your prenatal multivitamins. The ideal time to take your prenatal multivitamins is 3 months before the period of conception. But remember, we are in the era of the unknown. So no one can say exactly when they will become pregnant. So the best and the wise approach to make sure you have adequate components, adequate supply of the vitamins that will help you to have good outcome is to start immediately you are making love without protection. So generally in our group, we strongly advise all women who are intending to become mothers. Remember, there are other vitamins for women that might not be planning to become pregnant. Prenatal vitamins are meant for women who intend to become pregnant. So there are two different things. If you are not planning to become pregnant, if you just want, vitamins you're supposed to be taking every day that will help you to supplement. Remember, your vitamins are supplements. They are not drugs. You don't necessarily need prescription for everyday vitamins. Though, if you lack a particular vitamin, we can give you specific prescription. Thankfully, vitamins and prenatal vitamins are over the counter. It means you don't need prescription to get them. There's a big difference between wanting to become a mother and just wanting to be a normal, healthy woman. There's a big difference between your normal vitamins and prenatal. Prenatal is specifically meant for women that intend to be mothers. Now, pregnancy can happen anytime. Once you are making love without protection. So what do I mean without protection? If you are not using any contraceptives, remember you have about 13 methods for women, then you have about 3 methods for men. You can become pregnant. One of the consequences of lovemaking without protection is what? Pregnancy. What's the other consequences? Probably picking up sexually transmitted infections. So be mindful about that. So to answer the first question, when should a woman start taking prenatal multivitamins? The moment you intend, the moment you believe, the moment you nurse the idea of becoming a mother and you are making love without protection. So all women, both women in boy-girlfriend relationship, both women in fiancé-fiancé relationship, if you are making love without your partner, if you're making love without protection with your partner, please make sure you have prenatal multivitamins. That's when you start. Now, the question is why? Why are you taking this? Ordinarily, if we eat the right kind of food, if we are getting the exact quantity and amount of the supplements, of the minerals, of the nutrients we need, we don't need supplements. Unfortunately, we don't eat right. We eat the wrong kind of food. So we have a gap. So the gap is actually what prenatal multivitamins are going to fill. If you eat right to the letters, you're eating the right kind of food, you're not, eating the foods you're not supposed to eat, you don't need prenatal multivitamins. But unfortunately, 99.9% of women that will become pregnant will not eat right. So you need to supplement. That's why it's called supplement. It's not the real thing. It's not a replacement. Nothing can replace what you're supposed to get from your food. So it's because we are not eating right. So you supplement. That's the why. Now, there are basic components in every good prenatal multivitamins. I'm going to mention the important ones. By now, you should know that folic acid is the most important component in your prenatal multivitamins. Now, remember this. Your prenatal multivitamin is not a fertility drug. So it's not going to help you. It's not going to remove your infertility. It's only going to make sure that eventually, when you become pregnant, your baby will be healthy. Now, the biggest and the most important component in your prenatal multivitamin is what? Folic acid. Folic acid you can derive from the food you eat, but unfortunately, we are not getting enough. Now, when you are buying your prenatal multivitamins, you must lay emphasis on folic acid. Folic acid is very, very important in adequate development of the neural tubes. You see, by first trimester, all the important organs in the baby would have been fully formed. First trimester. Remember that pregnancy is divided into first trimester, second trimester, and last trimester. Each trimester is approximately 3 months. So pregnancy is something you need to plan ahead on time, because if you miss that first trimester, that's when a lot of damages will happen. That's when a lot of women will have miscarriages. That's when they will develop organ issues. So you must be well prepared. A good mother will look after the baby. Before you even became pregnant, you're already a mother. So because you're a good mother, you do all the things that will help your baby to thrive. So when you are focusing on the folic acid, you are making sure you have adequate quantity of folic acid, because it will help the baby's neural tubes to develop. Neural tubes are the structures that will help the baby's spinal cord, the brain, and the nervous system to develop properly. Now, in the event you don't have enough folic acid, if you are deficient in folic acid, it might lead to some problems in your baby. Top on the list is what we call spinal bifida. Spinal bifida is an example of neural tube disorder. So by simply taking your folic acid, which is already contained in the prenatal multivitamin, you don't need to take any extra one. So long as you have the adequate quantity inside that prenatal multivitamins, that's what you need. So by just taking it religiously, you are helping your baby to develop properly, even before your baby is conceived. So do you understand the logic? You are taking it ahead of time. So if you are already pregnant, you are in your second trimester, you have not done justice to your baby. You have missed a very important milestone in the development of your baby. So all the women intending to become mothers, starting from today, so long as you're making love without protection, please go to a good pharmaceutical shop. Make sure you buy unexpired prenatal multivitamins. So I want you to check the date. I want you to check the component. Make sure it has adequate quantity of folic acid, 400 to 600 microgram, not milligram. Just check it on the body. Once it's got that, you're good to go. Now, beside folic acid, there are also other important components you need. Number 2, iron. You see, as a woman, you need adequate supply of your iron. Iron is very important in making of the blood. So if you lack iron, and women bleed every month, so by default, women that bleed a lot will definitely have low iron levels. So by default, you're already lacking in iron by the fact that you're bleeding. So you're supposed to have adequate quantity of iron, okay? It's going to also be contained in the prenatal multivitamin. Now, be careful. When you take iron in excessive dose, it can alter and disrupt your gastrointestinal system. So you can have constipation, you can have vomiting, you can have stomach issues. If you take it beyond the quantity expected of you, it can upset your stomach, it can upset your intestine, it can lead to a couple of things. So iron is very important. So when you're buying your prenatal multivitamins, when you've checked the folic acid, make sure it also contains adequate quantity of iron. Beyond iron, calcium. You definitely can't go wrong with calcium. Calcium is very important in so many pathways in the development of your baby. Your baby's bones, teeth, and every paraphernalia that will help your baby to function properly. You need your calcium. Now, by default, you are already getting enough stuff from calcium, from the food you eat. So if you notice, most prenatal multivitamins, they might look like the calcium component is deficient, right? But it's because majority of the calcium you need, you're already getting from your food. So when you take your milk, when you take your cereal and all those stuff, check the calcium component. They are very important. So you're not just eating food to eat food for eating sake. You are eating food that will, have a lot of nutrients, provide you with what you need. So remember, folic acid, your iron, and your calcium. You can't go wrong with these three. These are the must component of the prenatal multivitamins. Now, there are other important vitamins, your B complex, your D, your C, your E. They are all there. Now, this is what you need to avoid. Once you have a current, not expired, completely formulated, not fake, which you have to go to a good pharmaceutical shop, make sure it's not expired, make sure it has adequate folic acid, adequate iron, adequate calcium, adequate vitamin A, D, K, E, and all that, then you don't need any other thing. You don't need to take extra. Now, some people might have a need to take more. So there are some women who might need to get prescription extra folic acid. But if you don't have any medical need to get extra, you don't need prescription. You just go to a good pharmaceutical shop. Make sure you're buying it from a control place. Especially if you're living in developed countries, there are so many fake stuff out there. There are some people that package chalk. There are some people that sell expired drugs. So make sure you read the label and go to a reputable pharmaceutical shop. Once you buy a good one, you don't need any extra. And there is nobody that is exempted from taking their prenatal multivitamins. I know you must have heard about fibroid, or if you have fibroid, don't take folic acid. Until the jury is fully back, the benefits you would derive, you and your baby, from taking folic acid far outweighs any concern we have related to fibroid and the growth of fibroid and taking folic acid. So folic acid, which is already contained in your prenatal multivitamin, is a must for all women that want to become pregnant. There is no exemption. Every singular woman in our community who plans to become pregnant should, by default, the first step you will take as a mother is to make sure you take this regularly, every single day, until you become pregnant. The most important period to take your prenatal multivitamin is 3 months before pregnancy and 3 months into pregnancy. So that period of 6 months is very important. But you don't lose anything by taking throughout the whole pregnancy. So we recommend you take it throughout the whole pregnancy, because by default, when you're pregnant, there are so many things you might not be getting and your immune system is messed up. So you need to be in a good place. You need to be fortified. You need to make sure you have enough supplements. So you don't have anything to lose if you take it beyond first trimester. But by default, you must start 3 months before pregnancy and 3 months into that pregnancy. So first trimester is very important. The reason why you need to take it in your first trimester is because by first trimester, majority of the important organs in the baby would have been fully formed. Now, second trimester is more of consolidation. Then third trimester, you deliver your baby. So very important step you can take as a woman who is gearing up, who is in training to becoming a mother, is a must. You can't afford to miss this. It's completely important you start today. If you are not taking it and you're intending to be a mother in 2023, Change your ways today. Okay, so that's my presentation very quickly. I'm going to open the clinic, and please have your questions ready. My COO is unavoidably absent, but she's sending her question. So I'm going to start with her question, okay? All right. Okay, so her first question says, is it okay to take prenatal vitamin if you are not pregnant? Remember, I mentioned that prenatal multivitamin is for women that intend to be pregnant. If you are not pregnant, if you are not planning to be pregnant and you're taking prenatal multivitamin, that's not good. You can actually have some health problems. There are other forms of vitamins you can take which are not prenatal. Prenatal is only meant for women that intend to become pregnant or women that are already pregnant. So that's the answer to that particular question. So let's continue. So the next question says, can vitamins and minerals make up for poor diet? So remember, they are supplements. In life, you can't replace original. So your supplements are more of artificial things. If you are not getting enough food from your diet, go and correct that. Your supplements, your prenatal multivitamin cannot completely replace your nutrients, what you should be getting naturally. So it's a supplement. It provides a gap. So it cannot replace your nutrients. So you need to work on your nutrients as a person that want to become pregnant. Very, very important. Who needs the vitamin and supplements? All women that plan to become mothers. Only. If you are not planning to become a mother, some people take a couple of vitamins and they say, oh, it helps to make my nails and my hair grow. Be careful. Be careful. Anytime you're taking anything into your body you don't need, you're ingesting poison. You're ingesting toxins. So avoid them. So it's strictly meant for who? Any woman that wants to become a mother. It doesn't matter if it's going to happen 10 years along the lane, but you have to start taking it religiously, okay? Is there anyone that should not take it? The last time we checked, every desiring mother should take it. There is no exceptions, okay? So even if you have fibroid, go and deal with your fibroid. If your fibroid is big, go and remove it. If your fibroid is not significantly big and it's not giving you any symptoms, then relax. But every woman, it should take it. There is no exemptions, okay? Okay, are vitamins and supplements regulated by any government agency? The answer is yes. In America, it's regulated by FDA. In Nigeria, I think it's NAFDAC. So yes, they have government agencies that ordinarily should regulate it because, look, when you are taking chalk in lieu of malaria drug, when you're taking chalk in lieu of antibiotics, when you're taking chalk in lieu of your prenatal multivitamins, what are you doing? You're taking poison. So it's regulated. This is why you don't go to that, Koro, Apianwe pharmacy in your location. Don't go there. Go to a reputable pharmaceutical shop, a pharmaceutical shop that actually has control from the government agency. So if you're living in America, a lot of them, Walmart, CVS, Walgreens, Rite Aid, there are so many. It's over the counter. You don't need any prescription, okay? But make sure you get it from the right place. Check the expiring date. Very, very important, okay? Let's continue. Okay, what are some safety considerations when choosing it? I've already mentioned that. Is there a way to evaluate the quality of a supplement? So what you can do by yourself is to be alert, is to focus, is to read the label. That's the best you can do now. So first of all, check the expiring date. Check and make sure you have adequate quantity of what you need. Your folic acid, your calcium, your iron, your omega this, your omega that, your vitamin A, C, D, K, E. Make sure they are all there, okay? Then somehow check and make sure it's a reputable pharmaceutical shop, a reputable pharmaceutical company. Then you've covered that from your own angle. So it's expected that if the government agency do their job, then you're not supposed to worry yourself about the other controls, okay? Is there such a thing like overdose of vitamins? The answer is yes. You can have an overdose. Now, some people can take excessive multivitamins that can mask deficiency in some vitamins, like vitamin B12. If you take a lot of folic acid, which if you take beyond the quantity you need, it can mask development of deficiency in vitamin B12, okay? All right, guys. Okay, let me see the questions we have. Okay. Can a mother continue taking multivitamin after birth? Yes. Now, there are specific vitamins you can take as a breastfeeding mother. Then remember, everybody in the family needs a vitamin. In my family, I have my own. My wife, she's got hers. The kids, Zara and Dumeja, we all have our own. My mom, my mother-in-law, everybody in the family should get age and gender specific vitamins. So the answer is yes. Now, the popular vitamin out there in Nigeria is Pregnacare. If you notice, they have before pregnancy, within pregnancy, breastfeeding, and otherwise. So when you're buying, check the category where you belong. So even after delivering your baby, you still need to supplement. Okay, let's continue, guys. All right, good afternoon, Doc. What causes severe anemia? You wanted to say anemia during pregnancy. When you are not eating properly, when you probably have overwhelming infection like malaria parasite can lead to anemia, when you're not getting enough food, when you have a lot of bleeding inside, when you have anything that affects your blood production or that leads to excessive bleeding or that damages your red blood cell can lead to anemia. Okay, so poor dieting can lead to anemia. Malaria, untreated malaria can lead to anemia. What if you're losing blood, if you're bleeding, you can lead to anemia. If you have some conditions that damage your blood cells, it can also lead to anemia. So any of those things can lead to anemia. So your anemia can be iron deficiency anemia, blood loss anemia, infection from malaria. It can be any of the anemia mentioned. So that's why in pregnancy, if you notice, we check your hemoglobin level and we check your PCV level so that we make sure you are not anemic. When you are anemic in pregnancy, it can lead to a lot of complications that can affect your baby, that can affect you. So this is the reason why we give you prenatal multivitamins and also treat you for malaria prophylaxis. Because if you live in malaria endemic region like Nigeria, the possibility you're going to pick up malaria is very high. So we don't want you to develop malaria. We treat you ahead of time. Okay, let's continue, guys. Doc, is it a must for couple with low sperm count to use fertility lubricants? 100%. The reason is simple. You are already contending with what? Low sperm count. So think about that. Let's be logical. Your sperm count is below 75 million, right? It's already low. Now you are buying a lubricant that kills sperm. So the reason why we are worried about the type of lubricant you're using is because some lubricants contain spermicides. Spermicides are chemicals that kill sperm. So imagine when you already have low sperm count, then you're now using chemicals that will kill the low sperm count you have. So let's assume you have 5 million and you're using lubricant. At the end of the day, you might end up having 1 million or below 1 million. So it doesn't make sense. So if you are having problem with lubrication, with dryness, with pain, if you are gonna use lubricants, make sure you buy fertility-friendly lubricants. An example is your Pre-Seed, your Baby Dance, and your Conceive Plus. So it's a must. Okay? What happens if you don't take prenatal vitamins while you're pregnant? You're gonna be deficient. So think about having a baby that has spinal bifida. Do you know how spinal bifida presents? Imagine your baby being born and the head is very, very small and the back of the neck and the back of the spinal cord is open. It's a nasty sight to behold. So just because you didn't do the right things, your baby can have a lot of problems. Okay? So that's what's going to happen. That's the end product. If you don't take your prenatal multivitamins on time, you can have abnormalities in your babies we could have prevented. So neural tube disorders is actually the biggest concern when we are encouraging you to take your prenatal multivitamin, especially your folic acid. So you have to take it. If you don't take it, you're predisposing your baby to developing all those medical problems. Okay? All right. What time of the day should you take it? It doesn't matter. Just make sure you take it daily. If you prefer taking it in the morning, if you prefer taking it in the afternoon, if you prefer taking it before you sleep, just take it. There is no specific time you have to take it. Now be careful. Some of those formulations can lead to constipation, it can lead to vomiting, it can lead to stomach upset. So if you have that, there are some situations your provider will also give you stool softener. So some women that might have a need to take iron, so they might give you iron because your hemoglobin is low, you're probably prone to having anemia. We might give you some iron tablets or some iron supplements. Unfortunately, when you're taking all these iron supplements, they can upset your system. You can have constipation, you can have difficulty. And if there is anything any pregnant woman should avoid is constipation. When you are constipated in pregnancy, is a nasty sight to behold. You don't ever want to be constipated. You don't ever want to be dehydrated in pregnancy because it's a nasty thing to go through as a pregnant woman. Okay, how long after taking prenatal vitamins can you get pregnant? Let me explain this. Your prenatal vitamin, it's not a fertility drug. So it's not a 1+1 that will give you 2. You are taking your prenatal vitamins not to improve your chances of becoming pregnant. So people just, misunderstand this. It's not going to add, it's not going to remove. You are taking it to make sure that when you eventually become pregnant, your baby is going to develop properly. So the question you're asking my sister doesn't add up. How long after taking prenatal is not a predictor of getting pregnant. If you are having pregnancy issues, you see a fertility specialist and they can figure out what the problem is. Okay? Very, very important you understand the reason why you're taking it. Does prenatal vitamin equate to balanced diet? No, it doesn't. What you need to do when you're eating your balanced diet, so balanced diet means you're eating your carbohydrate the right way, protein, oil, your fats and all that. You're eating them in right quantity. When you're doing that, you're getting the natural vitamins, the natural nutrients. But because we can't have 100%, you still need to supplement. So your prenatal vitamin does not equate to balanced diet. They are not equally opposite. They are complementary of each other. If you eat properly, then chances are that you might get 75% of what you need, but you still need to supplement the other 25%. Okay? Correct. You still need to eat properly. What's the best vitamin? There is nothing like best. Depending on your location, if you're in America, they have thousands. If you're in Nigeria, the popular one there is Pregnacare. So there is nothing like, oh, this is the best. So long as they are good quality, they are not expired, they have everything you need, you can buy any one. If you're in Nigeria, you can try the Pregnacare, but there are so many other good ones out there. Okay, so many. All right. Does prenatal vitamin make you to gain weight? This is another fallacy. This is another myth. Some women will be like, but doc, I'm not taking it, it's making me to be fat. No, the reason why you're becoming fat and you're gaining weight is because you're not exercising. It's because you're eating a lot of food. Some pregnant women eat all the food in the home and they don't exercise. The fact you're pregnant doesn't exempt you from exercising. You're still supposed to exercise, but you make sure your exercise is mild and moderate exercise. So prenatal vitamins do not lead to weight gain. The reason why you're adding weight, the reason why you're not losing is because you're not doing the right things. You're not eating right and you're not exercising. Very important. That's a big misconception. Okay? Side effects, like I mentioned, you can have constipation, you can have vomiting. Some people, they might feel they might have dizziness, or some people, they might just minor side effects here and there, but nothing major. Completely nothing major. That's why we keep it on over the counter. Okay? Guys, I have 3 more minutes. 3 more minutes to round up. Ask your questions, Make sure you share this with your friends. It's important. It's important you take this. If you are already pregnant, let me pray that you're just in your first trimester. You cannot be pregnant and you're not taking your prenatal multivitamins. You're not a good mother. You have to take it. Okay? So if you are already pregnant now and you're not taking it, you better start. You have to go and take it. Okay? Take it for the whole duration of your pregnancy. If you are not pregnant yet, but you know that by 2023 you're going to be a mother, start taking it today. So long as you're making love without protection, you're a candidate for prenatal vitamins. Start taking it immediately. Guys, 2 minutes. Let's go. 2 minutes so we can go. Ask your questions, please. Ask your questions. Do you have further questions? Okay. All right. Now, tomorrow we have a big event. Okay. Please, gummy good for toddler. That's okay. There are age-specific, gender-specific vitamins for kids. My kids love the gummy type. If that's what they prefer, just give them. But remember, some women might have a need to take more. Run anything you're taking by your ANC doctor. Very important. But for the kids, any gummy one is okay for them. Okay? Especially if they're picky eaters. Some kids are picky eaters. Like my son, Dumeje, is a picky eater. A picky eater means they might not necessarily be eating the stuff that will help them. They might be feasting on snack here and there. Those kids need to be supplemented. Very, very important. So if you have a picky eater kid, make sure you supplement. Every single person in the family needs a supplement because we are not eating right. Okay, guys, thank you for coming. Now, tomorrow is a big day in our organization. Tomorrow we have a super masterclass, advanced in maternal age. When you get to age 35, you enter a new category of women, an elite exclusive category of women. Unfortunately, as you get to that 35, there are some changes in your body we need to talk about tomorrow. So make sure you still register today. Today is the deadline, 9 p.m. tomorrow. Make sure your partner will attend and we'll meet you guys halfway. My time is up. When taking multivitamin, do you still need to take folic acid? No. This is the question I keep getting. Folic acid is a component of your prenatal vitamins. So if you're taking extra folic acid when you're taking your prenatal multivitamin, you're taking excess, you're wasting it. You don't need to take extra folic acid unless your provider recommends it. But if you don't have any need, the one you have in the prenatal multivitamin, it's enough. See me on Tuesday, okay? Tossi, thank you so much. I hope you're attending the event tomorrow. Thank you for coming. You've been very regular. Matter of fact, my admin is not in attendance, but please, I don't know if you registered, but you've been very regular, and thank you so much. Now, remember, if today is the first day of attending this open clinic, every Saturday, 12 p.m. Eastern Time, 5 p.m. Nigerian time, you will find us here. Tuesdays, we come a little bit late because of timing, 6 p.m. Eastern Time, US, 11 p.m. Nigerian. We talk about every single important health topic that will help you to become a better you, especially in maternal and child health issues. So thank you for coming. Make sure you subscribe. Make sure you share this with all your friends. We have an exclusive community in YouTube. So if you desire to have one-on-one with me on one-on-one basis, you can go and check the community and join the exclusive package we have. Until then, remember, if every other thing fails, God will not fail you. So keep on praying, keep on playing. Playing means 48-hourly love making. Keep it real and keep on practicing and enjoy your weekend. God bless you, and I'll see you guys on Tuesday. Until I see you, God bless you and bye-bye.